Your kidneys can heal, but only if you stop making these 9 mistakes. That might sound like a bold statement, especially if you've been told that kidney damage is always permanent. But as a nephrologist, a kidney specialist, I've had the privilege of guiding patients for over 25 years, and I've seen firsthand the remarkable resilience of these vital organs. While severe damage isn't always reversible, the progression towards further decline can often be slowed, stabilized, and sometimes even partially improved if we remove the factors that are actively causing harm. Many people feel overwhelmed or frightened by kidney concerns, and that's completely understandable. But feeling powerless isn't helpful. The truth is, many common everyday habits, things you might be doing without a second thought, can put significant strain on your kidneys, preventing them from functioning optimally and hindering any natural healing processes. By identifying and addressing these specific mistakes, you empower yourself to become an active participant in your kidney health. Medical research consistently backs this up. Numerous studies confirm that making informed lifestyle choices and avoiding certain pitfalls can profoundly impact kidney health outcomes. In this video, we'll discuss 9 specific common mistakes that can sabotage your kidney's ability to heal. We will look at the medical reasons behind why each one is problematic. I'll share some anonymized examples from my practice to illustrate the points. And most importantly, I'll provide clear, actionable steps you can take. And please pay close attention when we discuss mistake number 6. It relates to how certain medical tests are performed and is something you absolutely need to be aware of and discuss with your doctors if you have any level of kidney impairment. References for the studies mentioned can be found in the description below. Before we begin, I'd like to ask, where are you tuning in from? And what's one specific goal you have for improving your health in the coming months? Sharing goals can be very motivating. Please feel free to mention it in the comments. Okay, let's explore these crucial points. The 9th dangerous mistake is ignoring persistent swelling or edema. Many people experience occasional puffiness, especially in the ankles after a long day. But persistent swelling, particularly in the feet, ankles, legs, or even around the eyes, especially in the morning, should never be ignored. It's often one of the first visible signs that your kidneys aren't filtering fluid properly. Here's why. Healthy kidneys balance fluids and electrolytes, removing excess fluid and waste through urine. When kidney function declines, they become less efficient at removing this excess fluid and sodium. The fluid then builds up in your tissues, leading to swelling, known as edema. While other conditions like heart failure or liver problems can also cause edema, it's a very common symptom related to kidney issues. Ignoring it means delaying diagnosis and treatment, allowing potential kidney damage to progress further. I remember a patient, Mrs. Green, 67. She mentioned almost casually during a checkup that her shoes had been feeling tight for a few months, and her ankles were always puffy by evening. She dismissed it as just part of getting older. We ran some basic blood and urine tests, which revealed previously undiagnosed stage 3 chronic kidney disease and some protein in her urine. The swelling was her body's early warning sign. Because we caught it due to that symptom, we were able to implement strategies managing her blood pressure, dietary changes, that helped stabilize her kidney function and significantly reduce the swelling. Don't dismiss persistent swelling. Discuss it with your doctor promptly. It warrants investigation. The 8th dangerous mistake is not knowing your family history. Your genes can play a significant role in your risk of developing kidney disease. Certain conditions that directly impact the kidneys, or conditions that are major risk factors like diabetes and high blood pressure, often run in families. Here's the connection. Polycystic kidney disease, PKD, for example, is a common inherited disorder causing cysts to grow in the kidneys. Alport syndrome is another genetic condition affecting kidney function. Furthermore, a family history of diabetes or hypertension significantly increases your risk of developing those conditions, which, as we know, are the top two causes of kidney failure. Knowing your family history allows you and your doctor to be more vigilant with screening and proactive with preventive measures. I treated a gentleman, Mr. Davies, 62. He came in with moderately elevated blood pressure. During our initial consultation, I asked about his family history. He recalled his father had needed dialysis late in life, but he wasn't sure why. This prompted us to screen his kidney function more closely than we might have otherwise. We found early signs of kidney damage, microalbuminuria, likely related to his blood pressure. Because of his family history, we were extra aggressive in managing his blood pressure and monitoring his kidney health closely. He has remained stable for years. If you have a parent, sibling, or child with kidney disease, diabetes, or high blood pressure, make sure your doctor knows. It influences your screening schedule and prevention strategy. Our seventh dangerous mistake is excessive alcohol consumption. While moderate alcohol intake might be acceptable for some healthy individuals, excessive or binge drinking can harm your kidneys both directly and indirectly. Here's how. Alcohol changes the function of the kidneys and makes them less able to filter your blood. It's also dehydrating, which, as we know, puts stress on kidney function. Heavy drinking can significantly increase blood pressure, a major risk factor for kidney disease. Furthermore, chronic heavy alcohol use is a leading cause of liver disease. When the liver is damaged, it impairs blood flow and detoxification processes, putting an enormous secondary strain on the kidneys. This is known as hepatorenal syndrome in severe cases. Binge drinking, in particular, can cause acute kidney injury due to sudden dehydration and electrolyte shifts. I worked with a patient, Mr. Thompson, 58, who engaged in frequent binge drinking on weekends. He developed acute kidney injury after one particularly heavy bout. While his kidney function recovered after he stopped drinking and received supportive care, the episode served as a serious wake-up call. We discussed the direct impact alcohol was having. He sought help for his alcohol use. And not only did his kidney health stabilize, but his blood pressure and overall health improved dramatically. If you drink alcohol, do so in moderation. Generally considered up to 1 drink per day for women, up to 2 for men, and avoid binge drinking entirely. If you struggle with alcohol use, please seek professional help. It's crucial for your kidneys and overall well-being. If this discussion is clarifying some important health connections for you, please consider giving the video a like. And remember to subscribe and turn on notifications so you receive the next part, where we'll cover more critical mistakes, including that surprising one related to medical tests. All right, let's discuss the 6th dangerous mistake: undergoing certain medical tests with contrast dye without proper precautions. Medical imaging tests, like CT scans or angiograms, sometimes require the injection of a special dye, called contrast media, to help doctors see blood vessels or organs more clearly. While these tests are often essential for diagnosis, the contrast dye itself can potentially harm the kidneys, especially if your kidney function is already reduced. This is known as contrast-induced nephropathy, CIN. Here's the mechanism. The contrast dye is filtered out by your kidneys. In some individuals, particularly those with pre-existing kidney disease, diabetes, dehydration, or those taking certain medications, the dye can cause direct toxic damage to the kidney tubules or severely reduce blood flow within the kidneys, leading to an acute decline in function. While newer types of contrast dye are generally safer than older ones, the risk is not zero. This is why communication with your doctors is absolutely vital. Before undergoing any test involving contrast dye, you must inform the ordering physician and the radiology department If you have any history of kidney problems, diabetes, or if you are taking medications like metformin, they need to know your most recent kidney function test results, usually a creatinine level or eGFR. Knowing this allows them to take precautions, such as ensuring you are well hydrated before and after the test, using the lowest possible dose of a safer type of contrast, or sometimes choosing an alternative imaging method that doesn't require contrast dye. I recall a case where a patient, Mr. Jones, 71, with known stage 3 kidney disease, was scheduled for a CT scan with contrast ordered by a specialist for a non kidney related issue. He didn't think to mention his kidney history to the specialist or the radiology team, assuming they already knew. He underwent the scan without specific hydration protocols. A few days later, he felt unusually fatigued and unwell. Blood tests revealed a significant acute drop in his kidney function. Thankfully, with hydration and supportive care, his function returned to baseline, but it highlighted a critical communication gap. Always be your own advocate. Ensure all your doctors are aware of your kidney status before any procedure involving contrast dye. Now for mistake number 5. Believing natural automatically means kidney safe for salt substitutes. Many people trying to reduce their sodium intake turn to salt substitutes. While reducing sodium is excellent, many common salt substitutes contain high amounts of potassium chloride. For people with healthy kidneys, this usually isn't a problem. However, for those with impaired kidney function, it can be extremely dangerous. Here's why. Healthy kidneys are responsible for excreting excess potassium from the body. When kidney function declines, this ability is reduced, and potassium can build up in the blood, a condition called hyperkalemia. High potassium levels are a serious medical emergency, as they can cause dangerous changes in heart rhythm, muscle weakness, and even cardiac arrest. Many salt substitutes replace sodium chloride with potassium chloride, delivering a very large dose of potassium. I had a patient, Mrs. Diaz, 68, with stage 4 kidney disease. She was very diligent about following a low-sodium diet. Suddenly, her routine blood tests showed critically high potassium levels, requiring urgent treatment. She was baffled as she hadn't changed her diet much. Upon careful review, we discovered she had recently started using a popular salt substitute generously on all her food, thinking she was making a healthy choice. That substitute was almost pure potassium chloride. By unknowingly adding large amounts of potassium, she had put herself in danger. We advised her to stop the substitute immediately and focus on flavoring her food with herbs, spices, lemon juice, and vinegar instead. Her potassium levels returned to a safe range. If you have kidney disease, never use a salt substitute without discussing it explicitly with your doctor or renal dietitian. Read labels carefully and focus on non-salt flavorings. The 4th dangerous mistake is consuming too many high oxalate foods without balancing them. Oxalates are natural compounds found in many healthy plant foods like spinach, rhubarb, beets, nuts, and bran. In most people, oxalates are harmlessly excreted. However, for individuals prone to certain types of kidney stones, calcium oxalate stones, the most common type, or in rare cases, high oxalate intake combined with other factors can contribute to kidney damage. Here's the connection. Oxalates bind with calcium in the urine. If the concentration of both is high and urine volume is low, they can form sharp crystals that develop into painful kidney stones. While the link between dietary oxalates and chronic kidney disease progression is less direct than other factors for most people, recurrent kidney stones can cause kidney damage over time. More importantly, the advice isn't usually to avoid these healthy foods entirely, but to manage them wisely. The key is often calcium intake and hydration. Consuming calcium-rich foods along with oxalate-rich foods allows the calcium and oxalate to bind in the gut rather than in the kidneys, reducing stone risk. Adequate hydration also keeps urine dilute, preventing crystals from forming. Extreme, unbalanced diets, like juicing massive amounts of spinach daily without adequate calcium or hydration, could potentially pose a risk. I consulted with a patient, Mr. Lee, 63, who kept forming calcium oxalate kidney stones despite trying various remedies. We reviewed his diet. He was eating what he thought was an incredibly healthy diet, including large spinach salads daily, but he avoided dairy, a major calcium source due to lactose intolerance. He wasn't pairing his high oxalate greens with sufficient calcium from other sources, like fortified plant milks or calcium supplements taken with meals. By adjusting his diet to include calcium-rich foods alongside his salads and ensuring excellent hydration, his stone formation significantly decreased. If you have a history of calcium oxalate stones, talk to your doctor or dietitian about managing oxalate intake. It's often about balance and pairing, not complete avoidance. Moving into our top 3, the third dangerous mistake is ignoring changes in urination. Your urine provides direct clues about your kidney health. Changes in frequency, color, smell, or the appearance of urine are often early indicators that something isn't right, yet they are frequently dismissed or ignored. Here's why paying attention is important. Healthy kidneys concentrate urine appropriately and filter waste without losing important components like blood cells or large amounts of protein. Changes can signify problems. For instance, increased frequency, especially at night, nocturia. This can indicate the kidneys are losing their ability to concentrate urine effectively. Foamy or bubbly urine. This is often a sign of excess protein, proteinuria, leaking through damaged kidney filters. Dark, tea-colored or bloody urine, hematuria. This indicates the presence of blood, which can signal kidney inflammation, stones, or other serious issues. Persistent changes in odor or cloudiness could indicate infection. Ignoring these signs allows the underlying kidney issue to progress untreated. I recall a patient, Mr. Harris, 64. He mentioned during a routine visit that his urine had seemed extra foamy for a few months, but he hadn't thought much of it. We ran a urine test which confirmed significant proteinuria. Further investigation revealed early-stage glomerulonephritis, an inflammation of the kidney filters. Because he mentioned this seemingly minor symptom, we were able to start treatment early, control the inflammation, and preserve a significant amount of his kidney function. Had he waited until more severe symptoms, like swelling, appeared, the damage could have been far more extensive. Pay attention to changes in your urine. While not every change is serious, persistent alterations warrant a discussion with your doctor, and likely a simple urine test. The second dangerous mistake is inadequate management of existing diabetes. We know diabetes is the leading cause of kidney failure, but simply having the diagnosis isn't the full story. It's the level of control over your blood sugar that truly dictates the risk to your kidneys. Poorly controlled diabetes, with consistently high blood sugar levels over months and years, relentlessly damages the delicate filtering units in the kidneys. Here's the mechanism. Excess glucose in the blood forces the kidneys to work harder to filter it. Over time, this overwork damages the glomeruli. High blood sugar also damages the small blood vessels throughout the body, including those supplying the kidneys, reducing oxygen flow and contributing to scarring, nephrosclerosis. Furthermore, diabetes often goes hand in hand with high blood pressure, compounding the kidney damage. The key takeaway is that achieving and maintaining good blood sugar control, typically measured by the hemoglobin A1C test, is paramount in protecting your kidneys if you have diabetes. I work closely with many patients managing diabetes and kidney disease. One stark example was comparing two patients, both diagnosed with type 2 diabetes around the same age. Mrs. Chen was extremely diligent about her diet, exercise, medication adherence, and regular A1C checks, consistently keeping her A1C below 7%. Mr. Williams, however, struggled with consistency, often missed medication doses, and his A1C frequently hovered above 9%. 15 years later, Mrs. Jen's kidney function remained relatively stable, with only minimal protein leakage. Mr. Williams, sadly, had progressed to stage 4 kidney disease and was facing the possibility of dialysis. Both had the same initial diagnosis, but the level of blood sugar control created vastly different outcomes for their kidneys. If you have diabetes, prioritize working with your healthcare team to achieve the best possible blood sugar control. It's the most powerful investment you can make in your kidney health. And the number one most dangerous mistake is delaying seeking medical care or skipping regular checkups. This might seem obvious, but it's perhaps the most critical factor. Kidney disease, especially in its early stages, is often silent. You likely won't feel it until significant damage has occurred. Regular checkups with your primary care doctor, including basic blood tests like creatinine to estimate GFR and urine tests to check for protein, are the only way to detect early kidney problems when interventions are most effective. Here's why delay is so detrimental. Catching kidney disease early allows doctors to identify and address the underlying causes, like high blood pressure or diabetes, more effectively. It allows for the implementation of kidney protective strategies, such as specific blood pressure medications, ACE inhibitors or ARBs, dietary adjustments, and avoiding kidney-damaging substances before irreversible damage occurs. Waiting until you have symptoms, like significant swelling, fatigue, or nausea, often means the kidney function is already substantially reduced, and the options for preserving function become more limited. I've had countless consultations where patients were referred to me with advanced kidney failure that could likely have been slowed or prevented if abnormalities found on routine tests years earlier had been followed up on more consistently. Sometimes life gets busy, or people avoid doctors out of fear. But those routine checks are your early warning system. They provide the crucial opportunity to intervene when it matters most. Please don't skip your annual physicals. Ensure basic kidney function tests, blood and urine, are part of your regular lab work, especially if you have risk factors. Early detection and proactive management are truly the keys to preserving kidney health. So, let's briefly review the 9 dangerous mistakes we discussed. 9. Relying solely on thirst. 8. Regular consumption of processed meats. 7. Overusing potentially damaged non-stick cookware. 6. Undergoing contrast dye tests without precautions. 5. Using potassium-based salt substitutes with kidney disease. 4. Consuming too many high oxalate foods without balance if prone to stones. 3. Ignoring changes in urination. 2. Inadequate management of diabetes. 1. Delaying medical care or skipping checkups. Understanding these points isn't meant to cause alarm, but rather to empower you. Kidney health is complex, but many of the factors influencing it are within your control. By recognizing these common mistakes and making conscious choices to avoid them, you are actively supporting your kidney's ability to function and potentially heal. This journey is about consistent, informed steps, not drastic overnight changes. Each adjustment you make, however small it seems, contributes to a healthier future. Remember, the goal is to work with your body, providing the conditions it needs to thrive. The feeling of well-being, the energy, and the peace of mind that come from taking proactive steps for your health. That's the real reward. Now, I'd like to hear from you one last time. Which of these 9 mistakes was the most surprising or eye-opening for you? And what's one positive action you plan to take for your kidney health moving forward? Sharing your intentions can be a powerful motivator. Please, let us know in the comments. Thank you for dedicating your time to understanding how to better care for your kidneys. If this information has been valuable, please show your support by giving the video a like, sharing it with friends or family who might benefit, and subscribing for more trustworthy health guidance. Take proactive care of yourself and be well.